Thank you. Nickie Aiken.
Thank you, Mrs Rees, and it is a pleasure to serve under your chairmanship, Jochen Vau. Equally, it is a pleasure, and I'm delighted that the Honourable Member for Oxford, West and Abingdon secured this debate. This is actually the third time I have taken part in such a debate in this place. The first two I had called, and so I'm hoping it's third time lucky from what I hear from the Minister this afternoon. I think before I talk about the wider issue and about ending rough sleeping, I think it's really important that we consider what the government has done so far, and the fact that £750 million has already been put in to funding this year alone to tackle rough sleeping and homelessness, particularly the £203 million investment through the Rough Sleeping Initiative this year, double what it was last year. So I think none of us can be under any doubt that this government is determined to end rough sleeping. And we saw that with the Everyone In initiative during the pandemic, where we saw national government, local government and charities coming together to collaborate, as my right honourable friend for Hastings and Rye has pointed out. But even then, even when we had probably 90% of rough sleepers housed during Everyone In, there was still that 10% of the most entrenched rough sleepers still on the streets in this city. I, as the MP for the cities of London and Westminster, know full well the impact of rough sleeping on our streets. Having the largest number of rough sleepers in the country, more than the next 3 boroughs in London combined. That shows how acute the issue is in Westminster. But it's equally important to point out, I think, that only 3% of those on our street have a connection to Westminster. And therefore it shows that this is a national and international problem on the streets of Westminster. Having been responsible for rough sleeping strategy and the services in Westminster for 10 years or so, until I came to this place, I know so well the brilliant work that the rough sleeping team at Westminster City Council do day in, day out, night in, night out, and working with partners such as St Mungo's, which provide the outreach service. Again, their outreach workers are out every single night of the year, on the coldest nights of the year and on the hottest nights of the year, including Christmas. And I pay tribute to them, the brilliant outreach workers, and I've been out with them so many times over the last decade. But the 10% that were left on the street, why were they there? It wasn't a case of not having somewhere to go. There was a room for every rough sleeper on the streets of Westminster, as there is tonight. Tonight, there will be 500 beds available just in this one borough alone, which I think is an incredible fact to have. But why are we still seeing people on the street? Because the vast number of people on our streets have got mental health, addiction problems. And from my experience and from what I'm told by St Mungo's and Westminster City Council's outreach teams, is that these people are some of the most damaged, vulnerable people in our society. And they need our help, they deserve our help. But when they have got such entrenched problems, it can take years to build up the trust with those people on the street. They will often refuse help. And I saw it myself. You know, I have lived in this city, in the cities of London and Westminster for 25 years, and in Westminster for over 20 of those. And I can tell you that during Everyone In, the 10% that we saw on our streets, and I live in Pimlico, and we'd come out every day to go shopping, and they were there, and they were so ill. They really were. And it's because of the drug and drink and mental health issues that they are suffering. So how do we go about helping those people who often refuse time and time again, even on the coldest days of the year? And I remember when I was responsible for rough sleeping at Westminster, taking the then rough sleeping minister out on the coldest day of the year. And he was shocked to find people still sleeping on the street. And it is during those times when we have our cold weather plan, where we open up churches and synagogues and other community halls, no questions asked. We don't even have to ask people's names. We just want people to come in to be safe, to save their lives. Even on those most dreadful nights of the year, people still refuse to come in. And why is that? And that is what we've got to tackle. And that's why I have been working with the brilliant people at Crisis, the equally brilliant people at St Mungo's and the Passage, to work together on repealing the Vagrancy Act. And from the question I asked the Secretary of State in February in the House of Commons, where he, and I quote, said that the Vagrancy Act should be consigned to history, I am forever hopeful that will happen one day, and perhaps the Minister can enlighten us. But we are working to replace that, because we think we've won the argument from what the government are saying, but what do we replace it with? One of the issues we need is to have a new approach, an assertive outreach approach, where we have the mental health and addiction services on the street available. We used to have mental health services on the street, but they have now gone. So we need those back, and we need to have an approach which is health-led, because we've heard about housing first. We have got the housing. We have got the hostels. We have got the temporary accommodation. We have got the move-on accommodation. It is about persuading those people who refuse to come off the street to give them that offer. And it's about tackling the reasons why they're on the street, the symptoms of why they're on the street. And if you ask any expert in outreach, they will always tell you it is about tackling the symptoms. And that is what it is about. I am very proud to be involved and a member of the Kerslake Commission, which St Mungo's is a secretariat, and I have seen the first draft of the report, which is coming out in a couple of weeks' time. And I think this is one of the most collaborative pieces of research I have ever seen take place on homelessness and rough sleeping, and I hope the Minister will welcome the abundance of recommendations that are coming his way in the next couple of weeks. But what I learnt from taking part in the Kerslake Commission so far is that, and it was UK-wide, and it was talking to charities and local authorities from across the country, is that we all believe in one thing, is that we can, working together, resolve the issue and tackle rough sleeping and resolve it for good. But many things that have been, many of the members here today have mentioned the issue of funding. And as I've said at the beginning, this government has probably put more into rough sleeping than any other government possibly for decades. And that is the right thing to do. But it is about longer-term funding. And I know from being responsible for commissioning services in Westminster, we need to know years in advance as much as possible. It doesn't work necessarily to have a year funding stream. We need at least 3 years. We need to be able to commission those services, and if we are going to tackle the long-term reasons why people find themselves on the street, then we need to have the services that are there for at least 3 years. So I would really, again, call on the Minister. My plea, once again, is for longer-term funding. I think it's very important also to say that, you know, if we don't come together on this, then we will continue to see people on the street, sleeping night in, night out. The latest figures in Westminster, the latest count was 171 people sleeping on the street. Much, much lower than in previous years, which shows that, you know, we are working together. And I think that shows that the Everyone In strategy has had a longer term effect. But the vast majority of those still sleeping on the street don't tend to be British. They tend to be from Eastern Europe. And again, we also need to look at how we, local authorities, not just in London, but across the country, can work with people who don't have any recourse for public funds. That is an ongoing issue, and if you ask any local authority or any charity that works within rough sleeping, they will tell you that. So, to conclude, I would like to pay tribute to the brilliant organisations, as I have said, and organisations like Hotel School, which is a scheme set up by the Passage along with Jeremy Goring of the Goring Hotel, because they understand that if we are going to help people off the street and turn their lives around, tackle their mental health or addiction issues, the reasons why they are on the street, give them a place to live, they also need skills and the ability to find a job. So Hotel School, which is based in my constituency, is about doing that, and it brings together hotels like the Goring, like the Ritz, and others, and provide real training and jobs afterwards. And I would love the fact if the Minister would join me on a visit to Hotel School in the near future, so you can see what the private sector and charities like the Passage are doing to work together. Madam Chair, I've probably gone on quite a long time now, but as you can probably tell, I am passionate about this subject. If I do nothing else in my time in Parliament, I just hope I can secure the repeal of the Vagrancy Act, but equally importantly, it being replaced with the legislation and the services and the approach that will tackle rough sleeping once and for all. And I really do think we can do this. And this government, from what I can see, and I've seen many governments in my time in Westminster in this role, that I think that this government, if any government can do it, it's this government. Thank you.